Reading is a multifaceted process that is important for the daily activities required in life. One area that research is particularly concerned with is in the development of reading in the early years of formal education, namely Prep to Year 2 when looking at the Queensland system of education. It is essential for teachers to understand how to approach the teaching of reading and the individual components that combine in order for successful reading education to occur. There has been a framework developed that encompasses the 6 important aspects of an effective reading program. They are oral language, phonological awareness, letter sound knowledge, vocabulary, fluency, and comprehension. These will each be addressed briefly prior to moving into an in-depth focus into oral language and comprehension. Another way to help you remember these big 6 is that you could perhaps use a little mnemonic or a song, and I've got one for you today. The way that I remember them is fluency, comprehension, oral language, vocabulary, phonological awareness, letter sound, knowledge. Now you know the big 6 of reading. Now you're going to have that stuck in your head for the rest of today. Oral language is a development of vocabulary due to being exposed to conversations, with varying amounts of the structure and sounds of the English language being established also. Phonological awareness is the ability to identify individual sounds within spoken words and conversations, rather than attending to the meaning. Letter sound knowledge is commonly referred to as phonics. It is as it sounds, in that it is the correlation of single letters and particular letter combinations and their associated sounds. Vocabulary involves the ability to understand word meanings and occurs during exposure to words in contexts, such as conversations, stories, and literature. When reading is occurring with appropriate phrasing and intonation according to the text that's being used, this is known as fluency. Finally, comprehension is where purpose is involved. The reader attends to the reason or reasons why they are reading and the purpose of the text that they have chosen. Now we're going to look at oral language and comprehension in more detail. Oral language is the capability to use words for communicating with others. When this interaction is occurring, it's a two-way street. Not only is there one person communicating and another one understanding it, but when a response is given in return, it also needs to be comprehended. So, oral language can be broken into receptive and expressive components. Receptive language is where people are listening, processing, and understanding verbal language, where expressive language is using words to communicate meaning. It's fairly common that receptive vocabulary is greater in a person than their expressive vocabulary. If we were to receive words in the context of a conversation or a movie, then there are more words that we would be able to understand at that point in time, but it's unlikely that we would be able to produce that many in our own speech. Comprehension is the ultimate outcome expected when reading and is where understanding of what is read occurs. It is a complex task where the reader must synthesize what is in the text with what they already know. In the Big 6 framework, reading comprehension is contributed to by all the other 5 elements. Such demands include the reader making connections with the text and with other known information on a topic or text structure, word recognition, interpretation of context-dependent vocabulary, being able to hold information in your memory beyond the duration of the text, and also interpret any emotions or characters that are in the text. These skills require pre-teaching before comprehension can be successful for children. Comprehension involves 3 different levels of teacher and student involvement. At the independent reading level, students experience texts that are easy for them to read, with accuracy that's greater than 95%. These texts should be able to be read fluently for children to attend to meaning rather than focusing on words and word attack strategies. The next level involves teacher support and is the instructional level, with accuracy of reading occurring between 90 and 95%. With support, students are able to focus on vocabulary, structure, and content. The final level is frustration, where students are not able to attend to meaning as reading the text themselves is too difficult, with less than 90% accuracy occurring. These texts are used by teachers instead for read-alouds, modelling fluent reading, for the purpose of exposing students to higher levels of vocabulary and structure. Most students enter into prep, the first year of formal education, with some oral language skills. They have been developing their vocabulary for years before they even reach the schoolyard. There is significant research that demonstrates that oral language development has a critical impact on the future reading achievement of children. A child's vocabulary skills at school entry is a significant predictor of future ability in reading. So, for those students who have low oral language ability upon entry into school, there is a strong chance that they will continue to struggle with reading skills. The simple view of reading identifies that comprehension when reading is a combination of word recognition and language comprehension. So from this literature, it can be concluded that poor oral language skills can lead to poor reading comprehension. Oral language difficulties, aside from being a predictor for poor reading outcomes, has immediate and severe ramifications in classrooms. When comparing a child with these difficulties to peers that do not, the child lacking in oral language skills is less likely to be involved in positive social dealings with their peers. Such interactions produce advanced communication strategies and oral problem-solving skills. However, as these students with difficulties are having a reduced number of these dealings, they are not learning the appropriate social dialogue. This can then become cyclic, in that their poor language skills keep them from interacting, which in turn keeps them from improving certain social skills. Such children as these are often involved in inappropriate methods of solving problems in the playground. Children with poor oral language often struggle with instructional tasks in classrooms. As they struggle to interpret or listen to what is being said by the teacher, they can also lack motivation. Sometimes it may be that students are perceived to be lacking in motivation, in that they're taking longer to get started because they're continuing to think or they're looking at their peers to get some clues as to what's going on. However, some of these children do tune out when they hear teachers talking, as they already presume that they will not be able to understand what is said. There are three different types of readers who struggle to comprehend. As previously stated, comprehension is identified in the simple view of reading as a combination of word recognition and language comprehension. One way of identifying which aspect a child is lacking in is to orally read a text to them to comprehend. If it's decoding that's lacking, then their comprehension will improve when they're required to listen instead, as these students do have the appropriate abilities for active listening. The opposite of this is called a poor comprehender. This is where the child reads aloud well, but struggles to understand the text. The third type of student is where they struggle to decode and they're unable to comprehend a text when it is read to them. These last two types, as they're both lacking in language skills, are likely to have similar difficulties as a child who has poor language, as listed previously. It is important to know that there are other factors, such as working memory, that can impact comprehension. However, working memory also affects oral language. The skills to be taught and the strategies used by teachers in the early years of education have similar elements for both oral language and reading comprehension, particularly when dealing with children who are in the latter two types of comprehension difficulties. Some strategies are specific to children who are struggling, while others are able to be used with whole classes and groups. Oral comprehension occurs before reading comprehension. As such, the evidence-based strategies that are to come combine both the teaching of oral language and comprehension. One strategy for the improvement of oral language is in the reading aloud to children most days, if not every day. Hattie identified an effect size of around 0.63 for oral language when reading aloud is used daily by teachers. When looking at effect sizes, anything over 0.4 is considered a desirable outcome. So this is obviously in the desirable range. The conditions to go with this are that the teacher is to read aloud, model their thinking, and orally interact with the child or children through discussion around the text. It is important that the skills of identifying new words, new meanings, how to make predictions, how to fix up when you've made a mistake, are explicitly taught and modelled. The reported benefits of read alouds identify that the use of small groups is best, allowing for a higher level of interaction. When reading aloud, it is best to use comprehension questions before or after reading so that children can attend to meaning during the reading. Teachers need to provide additional time and prompting when giving instructions to children with oral language difficulties. These children often require more instructions to be given. It is possible that the majority of a class may be able to process multi-step directions, but others will need support to follow them. Each instruction can be delivered singularly and in the appropriate amount of time given to complete it before providing the next step. They may also need accompanying gestures or for directions to be modelled in order to comprehend the vocabulary used in the directions. These students do need to be continued to be taught new words and new meanings. Furthermore, instructions need to be clear and accurate, often utilizing verbs at the beginning of the instruction. In providing all children a chance to participate in class, wait time, which is also known as thinking time, should be used. It allows children to comprehend what is said and then formulate a response. Another strategy for oral language involves social skills. Through the use of things like creative drama, dramatic play, even barrier games where there's other children in the room participating in it, there's a positive effect on children's oral language skills as well as their self-esteem. This may further assist children in developing appropriate social language and skills, particularly if they're supported by a teacher and that there's feedback given. Poems, chants, rhymes, and songs are also proven ways to improve language and comprehension. If new words are taught through oral language experiences such as these, children would also have more exposure and develop familiarity with the words and with different sounds of the English language even. This familiar content can then be used for teaching listening and reading comprehension skills. Furthermore, these contexts can be playful, improving children's motivation for learning. Oral language and comprehension skills should not be taught in isolation or only in literacy time. There are many cross-curricular links that can be made that are valuable for children to understand the importance and application of their newly acquired skills. One example is using these strategies in mathematics. Open-ended problem-solving questions provide opportunities for acquisition of new vocabulary. There are also multiple ways of approaching a task. So, first the question needs to be comprehended, then an attempt to solve must be made, then a solution needs to be explained and justified. Such activities can also be completed perhaps with partners or small groups to further aid the development of oral language. One final strategy for use with children is orally retelling stories. When children are reading a text at their independent comprehension level, which we spoke about earlier, that's at 95% or greater accuracy rate, they can work on their comprehension instead and focus on the events. They need to be taught how to use time connectives, how to sequence, and how to change the tense of words. To assist with recalling events, children can be encouraged to draw a few pictures to show those main events, or they can be given a small number of pictures from the text to use instead. By sharing their retell with a peer, and also with those visuals to go with it, this promotes positive attitudes towards learning and positive ways to share oral language experiences. When assessing children for difficulties, or even looking for a way to measure growth after the use of some intervention, it is important to note that many of the comprehensive and reliable sources are not suitable for a teacher to implement in the classroom. Instead, these types of interventions have to be administered by particular learning support specialists that are commonly found in schools. If you are in doubt as to whether these are appropriate or who should be administering these, it's best to consult the publisher, the assessment manual that goes with them, or the learning support specialist in your school. When assessing oral language, there's the Peabody Picture Vocabulary Test, with the latest one being the 4th edition. There's also the Renfrew Action Picture Test. Both of these are credible and highly researched methods. Another option that does both oral language and reading comprehension, and does include other skills outside of these also, is the Weschler Individual Achievement Test, which it's in its 2nd edition. Finally, one that's for reading comprehension alone is the Neal Analysis of Reading Ability. If these are not what you're after, if you're after something more of the monitoring side of things, then there are plenty of ways to use teacher judgment or perhaps existing teacher appropriate tools that are in your schools that are more suited to not measuring things for the purpose of then referring them onto a specialist or analysing if an intervention program has been successful. Such things that you could use if you're just looking for something for monitoring could be perhaps the way children are participating. It could be whether they're starting to follow those oral directions that you're giving. It could be that they're starting to provide appropriate answers to questions that are comprehension based, whether oral comprehension or reading comprehension, or even noticing an increase in their rate of vocabulary acquisition.